Nursing is an honorable profession. Looking at the whole person and looking at their family and how can we take care of all of their needs and the family's needs so that they can be healed well enough to go home.
Nurses are truly the heart of the hospital. They're the heart of healthcare. So many of the strides in making our healthcare environment better has actually come from nursing intervention and innovation.
The unique thing about nursing is that it's not just helping, it's connecting, it's motivating, it's guiding, and I think that was the most powerful thing that drew me to nursing.
I don't ever remember a time where I didn't want to be a nurse. I don't ever have a time where I was like, well, maybe someday when I grow up I want to be a teacher or like a princess or something like that.
The human body just fascinated me and I loved helping people, and so nursing was kind of the best of all of that.
The best day for me is when patients tell me their story. These people are walking through the doors, you don't know what goes on behind the scenes. And to hear everybody's individual story, that's the coolest thing ever.
I worked for most of my nursing career in the emergency department, so you can tell that I love the uncertainty of a situation.
I loved being there to be able to comfort people when they were really at their worst. It's profound, it's impactful.
This is a profession that you don't always get thanked, but at the end of the day, you know what you did for the people around you, and you know that if you weren't there, their life might have ended that day. That is incredibly rewarding.
The year before I graduated, we had a major polio epidemic. They would hire us to take care of patients. I really had no idea what I was doing, but I was taking care of him. Certainly is different than most professions.
So my mother is a nurse and her sister is a nurse, and my sister is a nurse. I have a twin sister who's a nurse, and her husband became a nurse. My brother married a nurse, and my other brother, his wife, became a nurse as a second career, and I'm a nurse.
This is my mom, and this is my youngest daughter, Kennedy.
So my name's Megan Duncan.
And I'm Megan's mom.
So this is my mom, and then that's my grandma, my aunt, and then Colin married my cousin.
So do you remember when Janet and I would play hospital?
Yeah, I remember that vaguely, yes.
When you got home from work, we would always run to the end of the street and wait for you to come home. We would hop in the car and say, what did you do during your shift that day?
That I remember, yes.
Absolutely delighted that my daughter wanted to get into nursing. I think it is such a rewarding profession.
And so I saw her go through nursing school, and I saw her become a labor and delivery nurse, and she loved every moment of it. And she came home, and when she talked about her job, you can see how happy she was, and I knew that's what I wanted for my career.
I got into nursing because my mom, she's my best friend as well. She inspired me, and she's my idol.
I think it was her calling.
I think I had an influence on my girls wanting to be a nurse. I mean, I always talked it up. There was never a time when I said, oh no, nursing's not for you or something like that. I enjoyed my job.
The advice that I would have for girls and guys that are going into the nursing profession is be kind to yourself. Give yourself the love that you need so that you can go and give that love to other people.
I will hope for our nursing students and our nurses is that they grow and they develop and they just change the world. Like, that's what we want them to do. We want them to change healthcare. We want them to change the way care is delivered. We want them to improve access to care, all of those things. And really, nursing can do that.
Look, if you ever stop learning, you need to get out of the profession, because nursing is all about change and growth and getting better at what we do and learning new things. And that's why I've been in nursing it's been 39 years now here at NorthBay.
In nursing school, what made the biggest impression on me was I saw the amount of care for somebody who was on their deathbed. To be able to help them bridge into the next realm, to be that person, to say, hey, I want to guide you there and do it with dignity, has been the most impressionable experience, not just in nursing school, but over and over and over again.
Even though nursing has changed throughout the years, the thing that has not changed is a nurse caring for a patient. And what nursing has meant to my family is a stability in a career, knowing that there is growth and opportunity to be whatever you want it to be within the nursing field.
Really, nursing is the glue in so many ways, and the eyes and ears at the patient's bedside and within the organization, and it is absolutely essential to have a voice.
Nursing is so special in so many ways, and I think it's hard to put it all in just a one statement for me. But I know that there is nothing else I'd rather do than be a nurse, and I enjoy coming to work every day, and I can't wait for the rest of my career.